Hello everyone. This is a series of cases that I would like to share with you regarding the step-by-step how I manage these cases. So we have the upper lateral that they have a root canal previously. Now they do retreatment one time. So this is me that they do third time retreatment for the case. So this is a phenomena which is named as anchorasis phenomena that they give infection to the adjacent tooth. But today we are discussing the upper lateral. So it's named also the retrograde infection for the cases if you want to make more research about that. So we have this lateral, they do two very important faults or defects. So they didn't make a apical obturation or apical sealing. And besides that, they didn't do the disinfection. And we see some other thing which is very strange, really. So this is the case that I receive everything, every time I should take every case pictures or documentation, which is very important for me. So this is the pictures pre-operative, and this is that for this case that I do cold test to be sure that around the lateral, because we have a cystic lesion there. So I should make a cold test for these teeth, especially for the central and then for the canine. The canine show me abnormal response. So this means that there is something, as I show you before in the X-ray, there is touching of the lesion with the upper canine. So the golden step that I should follow is that I should clean the operative field, because we know we are fighting the bacteria. So every treatment and every treatment modality should be directed in a way that we control and minimize the number of bacteria. So here, after I clean the area, I put the rubber dam to be a septic environment. I remove the composite before. So I see the guttipercha, but here the access opening is really not standard access opening for me for the case. It needs more correction or refining, small touching. So the best thing is to use the front surface mirror for all case management, because they will relax your eyes. So the best bear is that we should choose the red one. So we should choose the big, which is pear shape or round, but this red, it will not scratch the ceramics over the crown. So this is after I finish the case, I see this white thing. Then I check, it is absolutely or mostly it is bioceramic that hardened, because I think the dentist they used. So I check the case with a prop. I see that the guttipercha is movable, and around the guttipercha I see the pus discharge. By the way, all these video, it is directly from the clinic without any adding or editing or any acceleration. So it's a real time in our clinics. So I see that the guttipercha is moved and the pus is discharged around the guttipercha. So I choose to H-file to grasp the guttipercha to remove it. And this is mostly used with most of the cases, especially that they have a space around. So I remove the guttipercha. The first thing I should use is to make a very nice cleaning and disinfection with the activation of irrigation with this last version of the activator, which is ultrasonic but new generations. It's very effective. Small, safe tip, which is plastic. So here I see some strange thing, which is cotton inside. I don't know why they put the cotton, but I think they have some mistakes that they do for multi-visit root canal therapy. So they put the cotton and they forget to remove it. So I think it will act like a sequestrum, a form inside the lesion. For this reason, they didn't heal, but besides that, there is bacteria inside. So I just use a H-file just to remove the cotton. Really, I'm very relaxed because I know there is something inside the canal which is foreign body. I remove it. Again, more disinfection and activation of irrigation is important. Then I need now a plugger which is very gentle, smart plugger, which is the traditional hand guttipercha. I choose size 100 and I just change it to plugger just by cutting with the blade number 11, the tip. Now it is changed to condenser. So I can just use this one as a condenser, but absolutely I should put it inside the alcohol to make sterilization for the guttipercha, which is now named as a plugger. Okay, now I choose a bioceramic putty from this company. Okay, then I take small amount, but should be careful. You should never use non-sterile instrument. Every time I should use sterile instrument. Here I use one side, one time touching. I never use other time. So I take small amount. and take it to the inside the canal. The canal now is disinfected, clean, dry, ready for the receiving the bioceramic. So I put the first layer, this is the second layer, and then the tool that mostly used for the condensation at the beginning, mostly the micro brush. So I choose the new one. Please, every time choose the new one. Then after this two very small layers, I should use another thing, which is a flowable or the traditional bioceramic, just to put all again small amount of the bioceramic again inside, then a layer, another layer of a putty bioceramic. Why? Because I want to make a hermetic seal, intimate contact for the bioceramic with the walls. So this is the final layer. I should protect this layer with the MTA liner light cure. And the markers is going, because every time after every case we should put the alcohol to disinfect these tubes. So the marking or the writing or prescription is going over the tube. After this layer, I should make a etch for the glass silicates or ceramics, which is the hydrofluoric acid. So I put the hydrofluoric acid over the area that I make beveling. Then I use a hydrofluoric phosphoric acid to remove the hydrofluoric acid, and maybe inside the tooth there is debris, and also to make etch to have a very good coronal seal. So we put the flowable now over the protected layer, which is the MTA liner. After that, we finish the case with the final restoration or composite over the area. So this is the preoperative, and this is the postoperative. Very nice coronal, middle, and apical seal, which is hermetic seal with the MTA paste or putty bioceramic. They have no difference, but nowadays putty bioceramic is the best. So we wait for healing for this case, and we are not sure about the canine. For the next video, I will show you what happened with the case. I hope you get benefit from this video. Join or enjoy our videos. Stay healthy.